pelvic floor exercises. I want you to sit on a block so that your perineum pushes into the block. If your knees are uncomfortable in this position, you can sit in a chair or on several blocks. You could also do the vertical position, it's just a little bit more narrow. So she'll place this underneath and the perineum is pushing into the block. The first exercise is to release the pelvic floor. When she inhales, you breathe in, the abdominals let go. You can feel the perineum push into the block, and then exhale, release. Continue with this breathing. You would do this if you're having any leaking, incontinence, or have a tight pelvic floor, or the first exercise you would do after having a child. So you're breathing in and letting the abdominals go, and exhale to soften. I want you to practice that most days if you're having if you have diastasis recti as well. The second exercise is the pelvic floor engagement. So she's going to take a deep inhale. She's going to exhale like she's blowing out one birthday candle and draw in front of the tailbone to in front of the pubic bone and lift up like a tissue coming out of a tissue box. Holding it up for 3 seconds and then release. So try it again for 3 seconds. You breathe in, let the abdominals go. Exhale to lift the pelvic floor, holding for 3 seconds, and then release. Continue with that exercise, holding, lifting and holding, and then release. Your workout program will have more specifics on how many days a week, how many times a day, and the length of time you're going to lift the pelvic floor, but this is the basics, that you're drawing both of those pieces together and lifting up. The second type of contraction is to hold the pelvic floor up. So she's going to take a deep inhale to release. Exhale, she's going to hold the pelvic floor up just a little bit as I count to 10. You're still going to breathe as the pelvic floor is lifted. 5, 4, 3, 2, 1, and release. After birthing a child, you might only be able to hold it a few seconds. That is okay. You're trying to work up to 10 seconds in a row. Try that one more time. Breathe and let the abdominals go. As she exhales, she's lifting the pelvic floor, and I can tell she's doing it correctly because her abdominals are contracting. She's holding for 5, 4, 3, 2, 1, and release. So the two types of contraction is the faster hold and then the slow, long hold.